Hello and welcome to this series, which the Atypical aHUS India Foundation is doing, where we talk to patients, their families, and understand their journey. Each individual has a very unique journey, I'm sure, in this whole vast area of aHUS, atypical hemolytic uremic syndrome, that we are all afflicted with. I'm Kamal Shah. I'm the founder of the Atypical aHUS India Foundation, and I am an aHUS patient myself. I was diagnosed in July 1997. So without further ado, I'm going to, get started with this interview today. So, sir, good. Thank you so much for taking time to do this interview with the Atypical HUS India Foundation. Let's start right at the very beginning. What were the first signs? What were the first symptoms that kind of led you to think that there is something wrong? If you could just talk us through the first instance where, something went wrong.
Yes, yes. First of all, Kamal, I'd like to thank you and also mention that what you're doing is really great because this disease AHUS, I've been also going through it similarly like you. So the first problem I encountered was knowledge about because I was also diagnosed in 2016. So I did not know anything about it at that time. I did not even know about dialysis or such. But all of a sudden, it all that roller coaster ride started in 2016, and then I just got to know more and more and more about this disease and also about CKD and all. So uh,
But what was
you're
the
doing
first
really great
what was
about
the
it.
first symptom you had that led you to think that there is something wrong with me? What did you have some
Yeah.
like some symptoms that kind of led you to believe something is wrong?
No, actually, I did not had any symptom at first. Uh, my life was perfectly going very well. Actually, it was very well. Not just good, but very well. I was doing my workouts perfectly. I was doing a job perfectly, and everything was fine until one fine morning. It happened like first started with lower back pain. It first started with lower back pain, and then one fine morning I started vomiting. So I went to a local doctor to get. I thought I might have some malaria, dengue, or something like that. So I first went to the local doctor. He gave me some medicines and just told me to have some rest. I came home, but the symptoms weren't disappearing, like vomiting and feeling dizzy, and like I was feeling heavy, very heavy over my eyes, my head, and everything. Actually, that was the first time in my life I actually felt how feeling sick feels because
Correct.
I was very healthy my entire life until the age of 21, until I was diagnosed with this, and now I'm 32. So this all happened in a flash. What happened was when the vomiting did not stop, doctor ordered the blood test. So I went and did the blood test. Then the reports came, and all the reports were like 100 times up and down all of a sudden. It was the first time I took a blood test also during that 6 sessions. The reports were like drastically like super bad. The local doctor couldn't even believe that I might have such reports looking at me. He told me to get a retest about it. He thought that there is a massive mistake about the reporting. So I again went and repeated my blood test in a reputed lab. And then again the blood test came and the results were similar. So initially he directly told me to get admitted in an ICU, in a good hospital's ICU. I went there, I got admitted myself alone. I did not inform my family then too. I thought it would be like something. That time I did not have such knowledge of medicine or science because I was just normal living guy. So I went to the ICU and then I got admitted. And when they started no treatments, IV and everything, setting the urine bag and all those things. But 2 days or 3 days happened in ICU and no updates or nothing else. They were trying to figure out what was happening. Initially, doctor told me that I have dehydration. So I told
Sorry,
him
how is
dehydration.
it?
Initially they told me that I'm having dehydration.
Dehydration. Okay, okay.
Yeah. So because they couldn't figure out what was wrong with me, right? So I was walking in
How
ICU
old were
to
you at
just
this
get
point?
21.
Okay.
So I was just walking in ICU, getting bored. I was like, till then I wasn't feeling that there would be such a drastic change in my life because I was just feeling that this is just a normal pass away disease and I'll be fine morning after a week or maybe so. So I was getting bored walking the ICU asking doctors what's going on. Nobody told me anything. But later they called a nephrologist there, and then it was the first time he came and told me that your kidneys are stopping at the moment, and it has already stopped basically. He told me directly to shift myself in a larger hospital where more services are available. The first thing came out of his mouth was like it would be very expensive because the course of treatment that we are gonna have, it would be very expensive. So it would be wise to choose a hospital where I could afford staying like for some 2 to 3 months or so. So that was very shocking for me because I wasn't even assuming that I might have some organ failure or like that. So later on, after 3 days, I shifted to a larger hospital under Dr. M. Nadu. So there things started to get messy, sort of. Mm. Then he tried to diagnose my disease first. First of all, he put me on dialysis there. It was very difficult to accept that time that I'll have to go dialysis also. So I did not know anything. I was just going with the flow. He told me that it would be temporary. It might be temporary, he told me, like a month or so. He did not even make my fistula there. He just kept saying it would be temporary, it would pass, don't worry. Because my kidneys were looking up. On top of that, kidneys were looking extremely healthy in so USG, like no swelling or no cyst, nothing. They were looking completely fine. Even the guy doing the USG, he was the head of Prince Khan Hospital sonography department. He was also like very shocked, saying, "With such healthy kidneys, and how come they aren't working?" That sort of thing. So even I was in shock that time. I did not know anything about that business. So the problem started there first. Dr. Badur asked about my family history. So in my family history, actually, I have a sister who passed away in 2009. My
Oh,
elder sister. Yeah. So she also passed away with kidney failure. But
oh,
it all happened. Yeah, it all happened in 2 weeks, all of a sudden. So she wasn't we weren't able to get her diagnosed. So we just thought, with her, it started with malaria. It started with malaria, and in 1 week, it proceeded to CKD, and the next week, she was got. So it all happened very fast without any proper diagnosis. It happened in the GP hospital. So we couldn't believe that time, or we couldn't even come to know what happened with her properly. But then when it happened to me, my parents got really scared because they had already seen this
right.
kind of thing in 2009. So they were like very actively involved in all the conversations with doctors, looking for the best hospitals and best doctors. We were a middle class family, but still, my dad tried to save my life that time. He was just retired with all his savings, gone in a flash. So I got admitted to Nasina Hospital under Dr. M. Bahadur, and there he diagnosed aHUS for me. First HUS, and then there were like 2 to 3 ways we had to diagnose whether it is atypical or something like that. So there was at that time there wasn't even this blood test available in uh, near my locality. So, we do not clinical uh, sequencing, genome sequencing.
Right.
So for doing that blood test, he told me that nothing would change. The treatment would be the same because we had very limited options. Right? And he told me the treatment won't change, but knowing what is causing it would drastically change the treatment plans we have in the future. So it's better to do it now only. We tried everything that anti-factor antibody tests and all those, RNA tests, all were like all were normal. So he also couldn't figure out why HUS was progressing. We initially diagnosed low C3 and C4, complement C3 and C4 were low. So because of that and because of my sister's passing away, he suspected HUS first. And then because of his vast experience, he treated me very in the best possible way. Even though it was very expensive, initially I had to go expensive plasma therapies at first because there was no option available. That time I had some residual kidney function. So I was having like dialysis a week or in 4 days, 5 days once. So that time he told me about this AHUS thing. It was the first we got to know what it is and what it is about and what are our options later in life. So finally, I was admitted there for some 25 days, and then later on, when he diagnosed the disease, he told me to go through regular dialysis only because we have no option there. Our parents
Did
got a bit
did
angry.
he talk to you about plasmapheresis or plasma infusions or any such treatment?
Yeah, he told me about it, my family and me. But he said that this is the only available treatment for us at the moment. And even though we can just assume that it is a HUS or anything else, the treatment wouldn't change. The treatment would be the same whether we do those tests. Actually, we had to do the test in Pune KM.
Right.
So my dad traveled to Pune in the morning carrying my blood with ice and all. So there we had to do that clinical exome test and the reports came a week later or something. And then we got to know that yeah, it is aHUS with nutrition in CFH gene, something
CF?
like that. CFH.
CFH. Okay. Okay.
Yeah. So so we got to know later on after that the report came. But he already said it that whether that report comes anything, the only available treatment to us is this plasma therapy. So then I got discharged from Masina Hospital and ultimately was left on dialysis. At the time of discharge, when my father got a bit angry because things weren't getting better, the treatment were very expensive. Um, all the treatments were very expensive, like plasmapheresis is so expensive. The dialyzer itself costs around 10,000 here in Mumbai for a session. So everything was going very expensive and the money was like we couldn't even grasp the situation, what was happening in our lives. Because all my father's saving was just going away in a flash and I was not getting better. So he got a bit angry and asked the doctor what's the problem and how to treat it. Like he's a young child and I was also looking very healthy outside, right? So nobody could get it, what's going on inside. It was like that at the moment. So at the discharge, he told me, see, if right now we are looking for any options to do anything, then I'll have to go through a liver and kidney combined transplant. So like then again I was confused and I thought, why liver now? Right? So, because my liver was all right.
Correct.
I never took any alcohol in my life. So with those things in my mind, it was also very shocking for us. So then I got discharged. I came on regular dialysis, but then I did not know anything about dialysis or CKD because I've never had anything in my life, right? Like usually what happens is when a patient progresses is stage 1, stage 2, stage 3, stage 4, and then stage 5 CKD. So while being in those stages, they uh, know us little by little, step by step, like what are the diet and what are the precautions we have to take and those things. They know about the disease being in those phases. But it happened suddenly with me. I did not even know that I had to drink less water. So everything was like going upside down in my life. Like, so initially when I got discharged, I did not know how much to drink. Doctors told me definitely. I did not grasp the gravity of it. I thought like it's a normal situation. Like you told me to drink less water and I will drink less. That sort of thing. I did not calculate it.
Correct.
Yes. So already my weight was dropping drastically after the discharge, and the water was building up in my body little by little. And I did not know those things. I used to feel breathless and all. So again later one day I felt completely breathless and I was like going into panic all of a sudden. I did not know it was happening because I need to go for dialysis or something like that. Now, if it happens, I know what to do, lift myself up, or and those things. But I don't know anything about that. So I again went into panic, and then my parents just rushed me to Bombay Hospital again because when I got discharged, I got to know the primary disease is not my organ failure. It was like having something in my blood.
Correct.
So later on, when we got to know, my cousin brother, he told us that I need to consult a hematologist. So we found a very renowned hematologist in Mumbai. I guess he's the best. Uh, he was the best at the time available. His name was Dr. Andy Agarwal in Dadar. He was very senior and he usually doesn't visit any hospital, but he specifically comes into Bombay Hospital only at times. So to get treatment by him, I got admitted in Bombay okay, under him. So there again, all my extensive treatments started uh, after having pneumonia. Was all the fluid had already built in my chest, lungs, and my heart. All the organs were failing. So there, we started extensive treatments, continuous plasmapheresis and dialysis for some 7 to 8 days. And I went into like a state of unconsciousness for some time because of those treatments. My body couldn't bear it. I already had become so weak. I initially was like around 95 kgs. But then when these things started happening, I started losing weight and in less than a month, I had already lost 15 to 18 kgs by that time. So I was getting weaker day by day inside. So he got me admitted. He started extensive plasma therapies for 7 days, I guess. And then during those plasma sessions, he used to replace cryo as a replacing agent. Cryo hai, and then FFP also. So we used to require like 24 to 25 bags of cryo or FFPs in a day at a time. So it happened like now how do we get those things every day? Because they usually don't give such a large amount to a single patient every day, and that too every day. So we got it for 2 days, and then the third day it wasn't available on Friday. So then my relatives opted up to donate whatever was required, and then in exchange for that, we got the new bags. It happened like that. So during those treatments, I went into a state of unconsciousness for some time, and then I was put on ventilator. And things were going south there too. We knew the diagnosis. It wasn't IMPS. It wasn't anti-factor H antibody mediated HUS or something. We knew it is like HUS because we had the report, my clinical exam report. The problem was that we only had the option of this plasmapheresis. Maybe if that time they would have had eculizumab or something, uh, I would have gotten better, and these things would have been avoided. What I had to go through during the time. So I went into a state of unconsciousness, and then it was like around 10 to 15 days. I was like very critical, and I was put on ventilator there. And after being put on ventilator, one fine day, doctor also told me that my bill had already gotten too high there. It was around 27 lakhs and something. But we weren't focusing on money that time, even though we were a middle class family. My father had just retired, and all his life savings, provident fund, and everything, which he thought would be enough to spend his remaining life with. He had to just spend it on me in like 1 to 2 months in a very short span of time. But still, we weren't thinking of money that time because things were going so bad that it's difficult. Okay. So after that, one fine day, doctor came and told us that your bill has gotten too high and the guy is not responding much, and he's also a ventilator in a state of unconsciousness. So they said that we should think about putting it off, right? Because the bill was too high, and they had already experimented with everything on me. All the available treatments were already put to use on me at that time. IVIG, you say, or doctor even said that we have already given you all the available antibiotics in the world to me. He said one day after I got into a state of consciousness. Actually, he told me that. So one fine day, the doctor decided to put it off, but my family decided to hold on a bit longer, even though it was being very costly. They weren't ready to let me go. Don't know what happened. Actually, maybe it were prayers or something. I actually believe that. So
Sorry?
when after that, maybe it were prayers, because everybody were praying desperately after knowing that I have less time and I was also an ventilator and not breathing manually and things like that. So when doctor told us to put it off, like close the ventilator and be off with it because the bill was going too high. So my family decided to hold on for 1 to 2 weeks more. And then after 3 to 4 days, I suddenly started regaining my consciousness. First, I woke up, and after waking up, my vitals started getting better. Maybe it was the remission at the time. It was the start of remission. So, in the state of remission, I woke up, and all those antibiotics and treatment worked. Maybe. So first I woke up, and then I started getting better first. I was put off from ventilator after a week, and then I my lungs also started regaining the strength to breathe naturally. First, my SpO2 went to 84, 85, something, 83, 84. So when the doctors saw, they were like very happy and also very shocked to see like such a drastic improvement in such a short span of time, because they had already tried everything and nothing was working out. I was just I my graph just going down and down and down for some time. And when it reached the maximum down it can go, it suddenly took a U-turn after that day. After that day, everything started getting better. Doctors decided that I was very young and could recover, and then they took me off ventilator, and then they initially put me on oxygen for some time for supportive oxygen therapy. But then when the some chest physician came and he saw things, he also took me off oxygen too. He said that I'm recovering very good and I will be able to breathe normally in 3 to 4 days. So I'll just need supportive oxygen therapy till then. So initially it started with 5 liters O2, then 4, 3, 2, 1, started decreasing it gradually and then took me off from oxygen therapy. So then what happened was like we again tried to treat me completely, but things of course went south. Like I was again left after the treatment sessions and everything. When I was about to get discharged, my final condition was not better before going and getting admitted into the Mumbai. It it got worse. I had lost 55 kgs in those 3 months. Uh, Initially, I lost just 15 to 18 kgs in first month, but after getting discharged, during getting discharged from the hospital after 2 months of time, my weight got to 48 kgs from 95 kgs. So such a drastic change for me. The first thing I lost was my confidence. Like I was a very well-spoken guy. I had already done my engineering. I was planning to go to Australia for my masters. Those were my plans. But things uh, really went bad, and what God had planned was something different. So I went into these treatment sessions and then came out like looking very bad, being very weak, and hardly surviving on my own. Couldn't walk, couldn't even eat properly. I used to vomit very bad time even after getting discharged from hospital for 1 to 2 months, around 1 to 2 months. So things just kept getting south, and the first thing I had to battle with was my confidence. Like I went into like serious state of shock and depression, sort of, because I couldn't watch myself into the mirror. Like previously, I had like built my body and everything, still comfortably and good looking sort of guy. And in 3 months of time, like I became a person like even I couldn't watch myself in the mirror. So first thing I had to battle to was shock and depression. And then along with this mental problems, I had to also fight with the physical condition I was in. I had to go through regular dialysis at times, and I used to vomit like not just regular vomit, but vomit my organs off. Like when I used to vomit, it was like my inside stomach. It was like such a thing. So later on, doctor told me that see, before giving me discharge, he told me that we have already tried all the available antibiotics in the world on you. Nothing's like left to give you as an option of treatment, available option. So he told me, see, what you do is you get discharged from here, you go home, you try to rebuild your life, you eat what you like, eat healthy, and try to regain your strength and do regular dialysis. This is what the doctor told me while discharging me from Omnis. So I asked him to. So what about transplant or complete treatment? He said, leave that thing for now. First of all, you have to regain your strength, and we'll discuss that later when we get all right. Okay. So again, I thought, okay, so now nothing left to do. I got discharged. I had already lost my job there. Then I came home and started studying about it. The first thing I decided, the when I decided to fight it, I started studying about the disease. I tried many things, trying to communicate people. Uh, I guess that was the time I found you also.
Right.
I found many people. I tried to. Uh, I also like had a talk with that. Actually, his name was Dr. Grimusi in Italy. He
Sorry?
was AHUS Dr. Grimusi in Italy.
Rimouzi. Yeah, yeah, yeah,
Italy.
yeah. Right.
Yeah, he was an AHUS specialist. I even had a talk with him. I mailed him my story and my reports, and oh, he told me that actually my doctor told me to have a convo with him, Dr. Babu. So I mailed him, and he responded actually. He saw my reports and he confirmed that it is AHUS only. But at that time, he wasn't researching on AHUS anymore. So he told me, he gave me an advice later on. He said that uh, I shouldn't go for a related transplant. That was the advice he gave him. But then still, I started recovering. I recovered myself, and after recovering, I got to a normal track. Like I, used to go to dialysis from 7 to 12 in the morning, and then at 12 I used to go for job at my job, and then 12 to 9 I used to go to the job, and after that again the next day like same routine, work and dialysis. Because we were not left with any money. I had no option except working. Even though I wasn't in a very good state, I was very weak. I had to work because my dad is aged, was also aged at the time, and he had already retired. So I started working, and then things started getting normal. But then in 2019, some 3 to 4 years later, I was doing good on dialysis also. Um, in 2019, there were some family scenarios in which we decided that yes, it's time that I had to try for a transplant because I couldn't live like this forever. But by that time, I knew everything that Solaris is not available in India, and the cost to get it from USA was so massive that we could not afford it, even through public funding and all those things. So, what options did we have? We had very limited options. And my nephrologist told me that no matter whichever doctor tells me to go for a transplant, I shouldn't go that time because I was definitely having VHUS, which other doctors were confused with. Other doctors wouldn't believe that it is this diagnosis or such a rare diagnosis could happen in these things. So he told me, no, it is definitely AHUS and you shouldn't go for a transplant right now. But because of family scenarios, I had a discussion with my nephrologist. He's actually, you might know him, right? Dr. Amin Nadu,
Yeah, yeah,
we
yeah.
spoke
Yes.
for. Yeah. He's also in workout also. So he told me, my father, my parents and I went to meet him somewhere. And we told him that sir, we have to have a transplant. It's time because our personal life is getting affected to an extent where we couldn't function normally anymore because my parents were getting old and they were also like mm, having normal health issues. and they thought that they wouldn't be able to support me after that because I would be on my own like I am now. So they thought, no, it's time. It is the last of our strength. Maybe we could try at that time. So we had a discussion with Dr. Bahadur. We went to Australia at that time. He spoke with some PHA specialists about Solaris, Eculizumab, and those things. So when he came back, he told me that how do we monitor Eculizumab, the administration of Eculizumab. So he told me that we monitor CH50, component CH50, complement 50. So according to the parameter of CH50, they start or stop eculizumab. So first thing he did was he checked my CH50, and as expected, it came to normal because it was in remission that time. So he told me, see, now at least we could try for it because my compliments were normal, AHUS was in remission, and he thought maybe he could control it with plasmapheresis later on after transplant. And so he planned a schedule for me about my plan. Got my parents checked in 2019. So in May 2019, I was saying, then my nephrologist went to Australia and discussed my case with some of his colleagues, and then came back with this thing. He told me about CH50 complement system and then how we were to plan a schedule for my transplant. So I had a kidney transplant on May 15th, 2019. So
Please
what he
louder.
did was,
Hear you.
hello,
Yeah, yeah, go ahead.
yeah. So on 15th May 2019, I had a kidney transplant. And before kidney transplant, he gave me a session, some 3 sessions of rituximab and those things. I did not know what those were about. I actually had complete belief in my nephrologist, even though still now he is a very good doctor. And whatever he told me, I just kept following it. So I had a transplant with my father as a donor in May 2019. So after the transplant, I was fine. All was good. All was well. My creatinine came back to 1.4 while I was in the hospital. Everything was fine. Even though I had some swelling, though it was still building up little by little, but still my creatinine was 1.4. My electrolytes were stable. My PET level were normal. So I got discharged from local hospital in some around 8 days or 9 days, perfectly being normal, and then came back home for recovery. I thought that I got back to normal, everything's fine now. Those things, like I was very happy. I was recovering. I was turning back to my old self very fast. Like my body was growing, my skin was getting better. Things were going good. I was feeling good actually. But then what happened was one day, uh, like after the transplant, we do routine tests, right? Uh, Routine tests like every 2 days, every 3 days at first. So I used to do creatine and CBC and all those tests every 2 days. So after like around 20 days, the first blood test, when my first blood reports came, my creatine just got up a little, 1.5. But because of my older diagnosis as aHUS, my doctor got worried. We already started screening for aHUS at time. Like he used to check some parameters in blood for red blood cell destruction happening in my body, cystocytes or something like that. I don't remember now, but he checked for it. And the parameter got, the report we got was a slight above normal limits. So he said it's okay. By the time we got the reports and all those things, my creatine already had gotten to 1.6 the time. So as soon as my creatine got 1.6, he directly told me to get admitted and get a kidney biopsy. And again, I got admitted in SNOP. I got a biopsy, and till the time the reports of my biopsy came in, which were PNA, pancreatic microangiopathy. So when my reports came back, my creatine was already 2.1 by that time. So we again started plasmapheresis, replacing blood component as cryo, and in 1 week my creatine was again back to like 7, 8, and my kidneys and my new kidney was again stopping. Had already stopped basically. The urine output had also gone by that time. So he started doing plasmapheresis by replacing cryo as a component. I actually remember there was the first time, the first day when we had plasmapheresis, I got my urine output back that later at night. Again, I started producing a lot of urine after the plasmapheresis. But the aHUS was already active that time also. It wasn't in remission. So even though I got my urine output back for some 2 days, the kidney couldn't survive. Even though the aHUS was very little, we already knew the diagnosis. We already knew the plan of treatment. We already followed the protocols. The doctor couldn't save my new kidney ultimately because we did not have this Solaris and Eculizumab available in India yet. At that time, if we had Solaris, maybe my new kidney would have also been saved at that time because I had initial diagnosis as PNA only when my creatine started rising. But later on, the plasmapheresis didn't work out as we expected, and the kidneys were already shut off. My WBC got around 700, like so low. Many things happened because I was facing rejection. So again, I had to go through these things like what we get on anti-rejection steroids, polymetrol, and all those things, and ideology. All those things I had to take to try to save my kidney, but nothing worked out. Right. So again, for a month, I was in the hospital. During that time, we tried every possible steroids and available alternatives to save my new kidney. Nothing worked out. So then the infection was spread so much in my body. Like again, my life was in danger that time. My WBC had actually dropped to 700, so low. So they were worried, right? They said that saving kidney is another priority, but now we have to save your life for now. Um, After that, actually, my doctor, those spec level and cell set medicines they will take now for transplant
Right, right.
immunotherapies. So they stopped those medicines
Hmm.
the time. They decided to stop because my life was in danger. So after stopping those medicines, the doctor had to decide whether to save the kidney or life. He took the call to save my life and then told me to get operated again, like to get nephrectomy done to remove the kidney, transplanted kidney, because the kidney has now started to produce infections in my body. So then I again had a nephrectomy got that kidney removed and recovered in around 15 to 20 days. Came back home, but then I was left with another problem now, and that problem was losing my hip, right hip, right and left also actually. Maybe because of those steroids and injection mats, my hip bone got like deteriorated. After coming back home, uh, I used to have a little pain in my little pain, sharp pain. But then it turned onto an unbearable pain in some around 4 to 5 months. So I couldn't bear that pain, and I wasn't even in a condition to have a hip replacement that time. So that my doctor actually told me to walk using crutches. I said, I'm sorry, but this life is not like this life is not accepted for me. And then I had a discussion with my nephrologist again, and I told him like I cannot live on crutches and with this pain. Even though it is risky, you have to do a hip replacement like that. So he told me that the risk is my bones are too weak for now because of all those treatments. Oh, even if I try to do a hip replacement, if I get a fracture anywhere else in my body during the time during the surgery, it would get very difficult to manage. And it is also very difficult to do a surgery in that condition. But still, I had to take the risk. I decided it for myself that living like this is like just not living for me. So I decided to take that risk, and I told him, no matter what I have to sign, I'll sign it, and you go for it. Replacement. You make me at least normal, even though I would be on dialysis, but I cannot manage like that because I don't have anyone to take care of me. So we decided to have a hip replacement. So now, after having a kidney transplant or rejection episode, around spending 18 to 20 lakhs again in 2019, we were left with no money. So then finally, I had to go for a crowdfunding option. So with this crowdfunding website, my college friends made for me, we raised money for hip replacement. And then I had a hip replacement, and by the grace of God, it worked out fine. So there was a time, it was my last treatment I took, and after I hip replacement, everything started to get normal only, like recovery, working, and living my life, trying to live my life normally on dialysis, those things. Until recently, I had a surgery for PTX because that was also a problem due to which my bones got deteriorated. So I had a right hip replacement, and doctor also told me that I would require a left hip replacement in the future. But I took that denosumab and those drugs in these 2 years, which actually made my bones a lot stronger, my weight a normal, bit normal. So now everything's fine. Basically, this was my journey with a lot of like upsets and troubles. But from these 3 years, everything looks normal and quite good now. Sorry for
No, no, no. I think that's really, thanks so much. We really appreciate you going over all the whole journey. I think that's going to be very helpful for our viewers. Very poignant. Very. I have to say, you've been really brave through this entire journey, and I think it's an inspiration to all of us on aHUS that, despite the setbacks that we face from time to time, I think your story has a lesson that it is possible to rise, after every setback and fight to get back our lives. So thank you so much for
yeah,
sharing your story, and I really appreciate it.
sure. Yeah, thank you for getting me on the platform and share it. I sincerely believe that we get something that makes us permanently good someday.
Absolutely. Absolutely. Thank you so much. Thank you. Bye
Yeah,
bye.
thanks. Thanks. Bye. Bye.